So you said you list or you days work finishes 6, half 6. Are you scheduled to 6, half 6, or are you actually meant to finish it?
So scheduled to finish around 6, half 6.
Right.
Our practice is open from 7:30, 8 to 6, half 6.
Right.
Sometimes those days are longer, and I go home at 7. That's very routine.
Yeah.
So, and that is sometimes early compared to some other regions and parts of the country.
Do you find that challenging? Do you find it quite intense or tough, or are you actually fine with it, or do you think that's just normal? I guess, how do you feel that it is actually an intense day?
Yeah, it's very, very challenging. For me, I'm quite lucky that I'm at a stage in my career where I have a portfolio career where I do a mix of roles.
Yeah, you do. Yeah.
And I work sort of part-time as a GP per se, so I see patients for...
It's quite normal for GPs to do.
For half the week, and the other half of the week I'm doing my more administrative roles.
Yeah.
But on the days where I'm doing clinics, it is very, very intense, and a lot of this is due to a variety of reasons. We have an aging population in the UK, which means the demand for healthcare is a lot higher. In addition to that, patients are becoming more and more complex, living for longer, requiring a more complex amount of treatment.
Yeah.
And there's more expected from the GP now.
Yeah.
We're not just dealing with just chronic conditions, we're dealing with a whole plethora of medical conditions and illness, and we are the gatekeeper to the wider NHS. If someone has a issue that would come to the GP, we would sort of see them, treat them if we can, and if possible refer them on. So that role as the gatekeeper does bring considerable amount of challenge and pressure, and that's why it's so important for primary care to be well resourced and well funded, and for us to have a workforce that is supported by the government, and to also ensure that we have a good number of GPs. Yeah. I'm very privileged and lucky that at our practice we've got a good number of GPs, but I know and heard of stories of other GP practices in London and around the country struggling day to day just because they don't have enough GPs, and that is due to the wider workforce difficulties in there just not being enough doctors in the UK per population. Compared to some of our European nations, for example, we have a lot less doctors per population, so we need to train more doctors, and we need more GPs.